Yeah.
There is only this fixed mic here. There's no other mic. Yeah. Yeah, there are 3 mics, but we have to off this one then.
No, rather we can work with both. Exactly. He's just
Okay. Have you pushed that? You have to put it for a longer time.
yeah.
Yeah. Hold on.
There's no update. So
Okay.
I'll prepare it tomorrow, inshallah.
No problem. So I welcome you all in your pathology section, right? This is your first pathology lecture. I'm Dr. Abrar Barakzai. We are 3 people here to teach you pathology in POD block. Myself. So what we will do is we'll fix some rules before I should start my lecture. Rule number 1, there will be no talking. You will talk with me directly, right? If you have any question, you can stop me anytime between my lecture, anytime. So please explain this thing and I'll stop and start explaining. But if you ask the same thing with your colleague, that will annul, right? Number 2, if you want to go out of the class, you don't have to take permission. You can stand up and go out, no problem. Even if you want to come in, you just come in and sit in the class without disturbing any other student. Okay. Regarding drinking, better to avoid because according to the university rules, but it's okay if you are drinking water. Okay, so wait for 1 minute more or okay. So pathology basically is not difficult. Pathology is not difficult if you just carry on pathology day by day session. For example, this lecture, you open the slides, and now the slides are always with you. So you just open this and then you can open the book. But this is a different slide. This is just an introduction, yes.
The mic is not working. The voice is really low.
Really?
No.
If I don't even use mic, my voice is, even I don't need mic actually. Are you able to listen me? Can you raise your hand? Yes, they all. So the problem is with the first. So anybody tell me what is pathology? Any idea? You people know about pathology? Yes. Uh-huh. Okay. But it's a very simple answer, as she said. Yes, you have any other one? Uh-huh. Yes. So basically, in your first year, you are dealing with anatomy, physiology, histology, biochemistry, cell biology. They are all normal things. Now we are coming from normal to abnormal. We'll discuss abnormal thing here in pathology, and after learning all the abnormal things, then you will go towards the clinical side to treat the patient. So if you don't know about the disease, how can you treat the patient? So this is very important subject to know about. So as you people said, it's a scientific study of disease, and it's in a broader sense, it's a study how the organ or tissue of the healthy body change with those of a sick person, right? So the person is sick. Now it is your duty to diagnose what is the problem. And this is pathology. Only in pathology, we don't treat the patient, we don't manage the patient, but we should know the disease process, right? And what is disease? Is a structural and functional changes that leads to loss of normal health. A normal individual become abnormal. How? So this is what we will be discussing here in pathology. So as I said, pathology basically is a bridge. Hmm? The anatomy, physiology, biochemistry, cell biology, histology. And this is a bridge of pathology. And then after learning this pathology, you will go to the clinical practice. So basically it's a bridge between the two things. And if you are a good pathologist or you know the subject of pathology, you will be able to treat the patient very well. It doesn't mean that you had to be pathologist like me. No, it's not necessary. But at least you know the disease problem. And honestly speaking, even after passing your third year, this is second year, we'll just discuss the general pathology here. After third year, when you know all the disease processes, in fourth year and final year, remember, always go back to third year book to see pathology. For example, any case come to you in a clinical site, don't hesitate to open pathology first, so that you should know the disease process, and by that you will be able to manage and treat the patient. So your pathology should be very good so that you can go on, treat the patient. Okay, it's clear up to here. Now we have multiple branches of pathology, multiple branches. Anatomic pathology, which I say is a king of pathology, because the major science rotate around this one, anatomic pathology. So what is this actually, this pathology? We see a gross and microscopic feature of that organ. For example, if the patient had appendicitis, he had a pain in the right iliac fossa, emergency, he went to the doctor, and then doctor said, oh, it's an emergency, we had to do operation now. He cut the lower abdomen and take the appendix out, and that appendix is sent to pathology department. This is called anatomic pathology. Now, if the specimen come to us, we usually see the appendix with the naked eye. That's called gross examination. We see because normally the size of appendix is very thin and small, but in acute appendicitis, it is swollen and large. So what we'll do, we'll measure the size of the appendix, we measure the thickness of the appendix, right? And then we cut it and take the sections. And we take the section and put under, we send for cutting process, which is a long one. We have automated machines now for dehydration. So when we cut the pieces and put it in a cassette, and that cassette is run in automated machine for dehydration. And once the tissue becomes dehydrated, then it is gone for cutting process, which is called microtome. That is usually done manually. And we take a 4-micron section of that tissue. 4 to 5 micron, not more than that. As thin as this section, as good you will see under microscope, right? If it is 4 and 5 micron, means the technical staff is excellent in making this light. You take this light and put it under microscope and then you see. That is another world. This is just like histology, which you people are doing. Gross is just like anatomy, which you were looking at cadavers. Microscopic is just like as you were looking at histology. In histology, a full horizon is there. Appendix, you will see different parts of appendix. You know how many layers of appendix? How many layers? You must know. They're coming from histology department. I'll talk to Dr. Annie. 3 or 4? 4. So what are those? If they are, sorry, yes, 4. Starting from, so that is called mucosa, then submucosa, then muscularis, and finally serosa. Adventitia, remember, in esophagus, there is no serosa, but there is adventitia. But from esophagus onwards, except one more organ, which is gallbladder, in which we have only 3 layers. Mucosa, muscularis, and serosa. We don't have submucosa here. One organ. Otherwise, all GI is composed of 4 layers. We see under microscope and we see all the 4 layers. Definitely, some of the inflammatory cells are present in mucosa in every GI organ. But if the same inflammatory cells you see in muscularis propria, then you call it acute appendicitis, mostly neutrophil. Usually in muscle layer, there is no inflammatory cell. But in acute appendicitis, the acute inflammatory cells spill and go towards the muscularis propria. And you'll see a lot of neutrophils there. The appendix is swollen, and then we give a report of acute appendicitis. Okay, clear? Yes. You are asking something? You are taking out your computer. Okay. The other branch is hematology. Definitely, you must be well aware of hematology. All the blood diseases, normal and abnormal both. For example, if the patient goes to the doctor, he asks for blood CBC, in which you go for hemoglobin, TLC, DLC, ESR. These are all hematological things which you are going to perform. But all the anemias, leukemias, lymphomas, they also be covered here, right? Microbiology. Sorry, about cytopathology. Sorry. Anatomical pathology, now there is another part which is called cytopathology. Now, cytopathology is basically a non-invasive procedure. For example, if you are taking out appendix, you had to take the patient in a OT, operation theater, and where you prepare the patient, then you give anesthesia, and the surgeon, the whole process. But cytopathology, you can do it even in your clinic, in your lab. You don't have to go for a big procedure. You just have to have a needle. For example, if somebody has a mass or swelling in the thyroid, and you wanted to check what is it. So instead of going directly to take out the thyroid gland, You just put a needle inside, take this stuff, material, put it on a slide, and fix it, stain it, and see under microscope. The yield is very good, about 95 to 99% of the cases time, if you are a good cytologist, you will be able to give the same diagnosis as you do while looking at microscope. Clear? So cytopathology is developing day by day because initially it was not that much developed, but now they are working a lot on cytopathology because it's a non-invasive procedure. You see this, you can do your diagnosis within hours. Yes.
So if the optic contributes to these
No, biopsy is the surgeon who is taking out the appendix. That is biopsy.
yeah.
What is the difference between biopsy and autopsy?
Okay, and then after that, after the autopsy is where the death person will be died on the you know the cause of the death.
A child can also die.
What?
A child can also die. A small baby can also
Yeah,
die.
I mean anyone.
Anyone,
Yeah.
not adult. Anyone who die after the death of the person, if you take these organs out to see under microscope, that is called autopsy. Biopsy, when the patient is alive and you are taking this section from that, is called biopsy. Clear? So biopsy you do in anatomic pathology, and the cells, cyto means cells. You are just looking at the cells, and you are so expert by looking at the cells, you will be able to make the diagnosis. For example, thyroid, if you have taken the cells, you are able to understand that you are talking about the inflammatory condition, you are talking about thyrotoxicosis, you are talking about neoplasia, adenoma, or carcinoma. So by taking those cells, it will guide you well. Now, after diagnosis, for example, you saw some of the glands. Now your differential is whether it is adenoma or carcinoma. In thyroid, when you will be studying your neoplasia, and Dr. Oban is going to take those lectures. So you will be able to understand what's the difference between benign and malignant. And we have some criteria of differentiation between these two. But in thyroid, the criteria of malignancy is totally different. So if you see the glands, it doesn't mean that they are benign. What you have to do that you have to take the whole nodule out along with the capsule, because the standard of diagnosing benign and malignant in thyroid is invasion of the capsule. Invasion of the capsule. So you have to take sections from the capsule so that you can easily see that these cells or glands are going into the capsule. You don't have to see the pleomorphism, hyperchromatia as you see in other tissues to call them malignant or mitotic figures. No. Only invasion into capsule, invasion into the vessels. Vascular and capsular invasion is a diagnostic criteria of adenoma. Follicular adenoma. Papillary is something different. So when you will come there, we will be discussing that. Cytology or cytopathology is a study of cells. Clear? Hematology is study of blood. Microbiology is a study of microorganisms. The biggest organism you always know is bacteria. So all the types of bacteria, viruses, spirochetes, fungi, they all actually microbiology. And Dr. Atif is taking care of your microbiology section. And he has made a big arrangement for your labs on Tuesday. And he has not kept a single lecture on Tuesdays. We want to have full concentration in your lab. And honestly speaking, they have arranged a very nice, beautiful labs. And they will show you how the bacteria or other things look like. Even parasites, parasitology, they are also coming. Then immunology, I'll not say it's a new one, but once when we were a student, immunology was a new thing. which was added in pathology. Now it has been decades now, very old. But day by day, it is coming up. Dr. Gawain is going to take your immunology lectures. Huh? And immunology, in which you will discuss the antigen antibody reactions, all the cytokines, chemokines, how they act, complement the system, and they act like in immunology. Clinical pathology, this is again a big branch in which you see the chemical things of pathology, like blood urea, blood sugar, huh? Cholesterol, triglyceride. You go for your routine blood check for these things, chemical pathology. Serum electrolyte, liver function test, kidney function test, they all come in chemical pathology. Then comes to the genetics, this thing is also evolving day by day, and all the molecular pathology things is coming under this one. And you have a lot of genetic problem, which we see under the heading of genetics. Then we have toxicology. Toxicology, anybody know what is toxicology? A chemical which hurts the body. So it's a study of the chemical which actually hurt the body. Forensic pathology. Again, we do this thing after the death of the person, and then this pathology, or it's a specialized branch of pathology, that the pathologist look for different organs and they evaluate the cause of death, right? So probably that person has taken any poison. So which poison he has taken, how he died. So this is all come under the heading of forensic pathology. Anything in this, or should I move? Okay. Now, text of pathology. So we have actually divided pathology in two main branches. One is general pathology, which you will be studying here in POD block. General pathology. We will just discuss a general things. We are not specifically looking at the organs. General pathology. Like on Thursday, Dr. Oban is going to start with cellular injury. So he will discuss cellular injury in detail. He will not specify, for example, in myocardial infarction, there is a cellular injury, but that is confined to heart, which we will be discussing in third year in special pathology or systemic pathology. So only the basic reaction of the cell and tissue to abnormal stimuli that underlie all tissues. So basic thing. I'm teaching you inflammation, the whole process of inflammation, how it starts, how it damages the tissue, and how it stops, and the consequence of inflammation. And after the inflammation is over, the repair process starts. So the repair process. After Dr. Oban's cellular injury, then I'll come back again with the whole inflammatory lectures. After my lectures, then Dr. Rehan will come and he will teach you about the hemodynamics. And after hemodynamics, at the end, Dr. Oban will come again to teach you about neoplasia, tumors. Okay, but he will just discuss the general conditions and processes of neoplasia. The other branch is systemic pathology, as I said, specific response, specific organ, specialized organ. For example, lung. So diseases of the lung. It could be inflammatory diseases or it could be neoplastic tumors, but it will be lung. GI, right? Urinary tract, muscles, whatever. So we will discuss one by one each organ, but they will be taught in third year. So in just second year, we will just telling you about the general items. For example, if you know inflammation in a good way, thoroughly, then if we apply the same inflammation to the lungs, it will be easier for you to understand what we are talking about. If you know about the tumors And if the tumor is in the lung, you know how this tumor behave. And then each organ will be discussed separately. There are some organ which has only one or two tumors, three tumors. There are few organs which have multiple tumors, like ovary, many tumors. So we will discuss all of them separately. Okay. Then some usual and unusual thing, which you can go across in pathology department. The words which will be used in daily processes. It is usual to find atheroma in the coronary artery of the middle-aged male in Saudi Arabia. So atheroma, is it normal? No, it's not. You know what is atheroma? The fat. You see this picture? This one?
Is it like atherosclerosis?
Exactly. So this atheroma is accumulated inside the artery. This is bad. Why it is accumulating? Is it normally accumulate there?
No.
No. It accumulates when you eat enough amount of fat, right? And the level of the fat increase in your blood, and that blood takes the fat to the specific areas like coronary artery. And when it is normally the lumen, this is the lumen of coronary artery, it was that much big, you see. But because of atheroma, it is squeezed, and now the lumen is so small. And what happened if it goes down? So this is my advice. You are a young people. Even in our Al Faisal University, there is a food court. Everything is available there. And when you cross, and if you have an aroma of a nice looking things, you got, influence to get and have one burger, one, many things there. Avoid all these things. This is not honestly good. One burger a week is okay. One burger is okay, no problem. Or one pizza, or one KFC, or one Kudu, whatever. But if you are taking it daily and you are not even exercising, if you are having this thing and you are doing ample amount of exercise, you are coming in university by walking, okay, that's fine. But if you are not doing it, you have a very luxurious car, eating burger, sitting in a car, come to the university, what will happen? This thing will happen, right? So you have to avoid from today, especially those who has a family history of atherosclerosis. If your parent has a heart attack, if your uncle, your aunt, your mother, your father is suffering from such things, yes. You want to ask any question? Yes.
I know, doctor, I was just thinking about what, like,
Ask me. If you are confused with anything, ask me. Yes.
with the exam, like, for this lecture, what exactly should we study?
We have not even completed the lecture. And she is basically upset by the exam. This lecture will be with you. And whatever questions I'll ask from this lecture.
How?
First of all, let me complete this one. We have just started. I'm making you understand what is pathology. Try to listen it. Remember, this is a problem with our student. I always ask my son, don't study to pass the exam. Study to learn the subject. And when you will learn the subject, the exam will be easier for you. But if you specifically learn to pass the exam, okay, you are in a very young age, but when you pass your MBBS, then your actual life will start. Becoming doctor is not a big thing. Nowadays, you have to have post-graduation. You have to go for STEPS exam. You have to go for specialized exam. Then you have to open the book to learn. When the patient is sitting in front of you, and if you are thinking of exam, let me go and open the, what's that? No. It should be in your heart, in your mind. Okay. Let me finish it and then probably I'll guide you a little. Okay. So it's not normal. Accumulation of that much fat in coronary artery. You know where this coronary artery is supplying? Heart. So if the artery is blocked, what will happen? Ischemia. And if it is ischemia of the heart, it will be myocardial infarction. Ischemia infarction will be taught by Dr. Rehan in his topic, hemodynamics. So what will happen then? Exactly, if you see these are the coronary arteries. This is a normal one. You see how much big lumen is, and as the patient is taking more and more fat, he's sitting in a luxurious car, not doing any exercise. What will happen? It will start accumulating here. The lumen becomes narrow and narrow, and the time will come. There is no space. It will block, and when it will block, what will happen? Myocardial infarction, ischemia of this area, and then suddenly dead of the myocardium. There are three cells in your body. When they are dead, they are never ever repaired back, regenerated. Heart, nerve, and skeletal muscle. So this is heart muscle. When it is dead, it's dead, gone. Okay. So when there is ischemia, what will happen? The patient will feel excruciating pain in the chest, very bad pain. Unbearable pain. Then they will take the patient to the hospital, emergency. And in emergency, the first thing will doctor do is ECG. And this is absolutely an abnormal ECG. Aberrant means patient had heart attack. And they will take a blood sample for some important tests. I'm not going to discuss now. So, day by day it is becoming normal, and finally it is almost normal, almost, not 100%, but almost. So by this stage, they also go for angiography, and then they start looking at the arteries. So they have a block here, they have a block here, they have a block here. So there are three vessels, although it is right and left coronary artery, but left coronary artery is still divided into two. Left coronary and anterior descending, and right coronary. They are called three vessel disease. If all the three vessels are blocked, then the patient is asked for CABG, means bypass operation. In a normal wording, it's a bypass operation, right? And then if it's only one vessel, then they put a stent to open the lumen of the coronary artery, right? Okay. Still, I hear some whispering in the class. Do you?
Yeah.
Yeah. And this actually disturbed me a lot. So whatever I have in my mind to deliver this thing to you will be blocked, and you will not get that thing which I wanted to give all of my knowledge to you people. So if you want to have a good lecture, good pathology learning, please don't talk. Okay? Then after doing this, and suppose, God forbid, the patient die, then we take what we will do? Autopsy. In autopsy, we have taken the heart out, and we have seen that this much area, this is called transmural. All of the layers of cardiac muscle is involved. Heart is involved, right? From here to here. This is called transmural. And then we do the histopathology of this one. And for example, the patient has died after 4 days. Then this type of histopathology will see under microscope. There are some cells which are totally dead here. There are some cells which have some nuclei. It means they are in a dying position, not completely dead. The edge cells. And if you restored the blood supply, if you would have, now it's dead. So probably that muscle cell would have probably grow up again. But now these are all dead cells, so these are all cognitive necrosis. Necrosis topic will be taught to you by Dr. Oban in cellular injury and necrosis. He will tell you how different type of necrosis you will see. This is cognitive necrosis. And these small cells, they are acute inflammatory cells, neutrophils. Okay? So this is all you look into it. Clear? Okay. Now there are disease as failure to adopt. For example, if there is a sudden loss of blood, if the blood is going out slowly and gradually, for example, if somebody has piles, hemorrhoids, the blood is oozing out slowly, it will not affect the person. Or somebody has peptic ulcer or gastric ulcer, the blood is oozing out very slowly, it will not harm that person. But if the person had had a road traffic accident, what will happen? A lot of blood will go out. That is actually not adaptable, and the patient will go in shock. This is called hypovolemic shock, Dr. Rehan. Influenza virus, if it is of a low virulence or less amount of viruses, it will only affect your upper respiratory tract. You must have seen when the season is changing, you start coughing. Most of them, they are because of influenza virus. But if this virus becomes very much high, what will happen? It will involve your lungs. Then you will be attacked by pneumonia. HIV virus in a smaller amount, you will just have a person will have only immune deficiency, not anything. But in a longer time, a big attack, he will develop AIDS. Ionizing radiation, everybody goes for X-ray test. Just one exposure, that's all. That will not do anything wrong. But ionizing radiation in a larger quantity will probably lead to cancer. Malaria, if you malaria is not that much common in Saudi Arabia, is it? No.
Because it's endemic.
Yeah. So, in our part of the world, it is very much common. So if the patient has malaria and he is treated well, nothing will happen. But there are few areas in which they are chronically involved in malaria. They will be having a severe anemia. Unhealthy diet, as we were discussing, one burger a week, nothing will happen. But you are eating daily one burger or two burgers, that will be dangerous. That will cause obesity. Smoking, it's not good. I hope mostly girls, they don't smoke. But there is a tradition of shisha now, just for to showing a. This is also not good. Honestly speaking, avoid this thing, even shisha. Although they think, it's not a smoking. It is actually. Once you have shisha, then the other day you will. Where is Baba? Where is Amma? Really, it happens. Don't do it because that will lead to cancer, heart attack, stroke. There are few people who are smoking 2 packets a day and nothing is happening. I'll tell you why.
Because it's chronic.
Huh?
It's chronic. Later on, they're gonna die. Like they develop cancer.
There are few people they never develop cancer. They don't. Yes. Yes. They have some genetic factors. But those properly, those few people. And if suppose somebody is sitting in a whole bunch of, because I was facing this thing all the time. We as a doctors tell the people that please don't smoke. You doctor always says, I'm smoking for last 50 years. Nothing is going on. Because probably that person is having that gene which is protecting him from that. And the other person, his friend, he doesn't have that gene. And ultimately, after 30 or 40 years, he will develop cancer, right? Okay. Influence and ability to adopt age. Slowly and gradually you adopt the thing. But as the age goes on, you will not be able to adopt the environmental insult, right? If you are young, you have a good what you call immunity, so you are able to hold everything. But as you become old, the same thing which you were, as a young people, you were not even thinking of it, you had to think of it. It's not. You must have seen that in winter season, you are not even wearing sweaters, and your grandma, grandpa, they are not only wearing sweaters, but coat, shawl, and they say, "Oh, we are shivering," because there is something different from our young people. Now, there are some genetic factors, like some people are genetically predisposed to not to be able to adopt environmental effect. For example, the people who had a genetic factor of sickle cells or glucose 6 phosphate dehydrogenase, they never develop malaria, because malarial parasite can never enter into the RBC of these people genetically. Or if somebody has cystic fibrosis, they never develop salmonella infection. So the typhoid will not be there in these patients. It doesn't mean that salmonella will not cause typhoid or malaria will not affect us. No, exactly like that. We have a chart here for, if you see here in the down one, this is gene and these are environment. So there are, for example, here, cystic fibrosis or hemophilia, purely genetic one. You don't have any environmental factor involved. And if you see at the other end here, it is a motor vehicle accident or gunshot. If suppose somebody die of motor vehicle accident, it's purely a environmental one. Or somebody shot anybody, that is purely environmental. No genetic is involved. But there are things which in between, like P53 cancer, BRCA1 breast cancer. I'll not go in detail, but you can prevent yourself from these genes, right? Exactly, the MOE, again, another one. You can treat the patient in a well early stages to avoid Alzheimer's. These cardiovascular disease, diabetes, asthma, for example, if somebody has a parent having what you call heart diseases, so from this age, this is a very good age of yourself. You are young, you can easily stop yourself. For example, if your father and mother are diabetic, both, you have more than 60% chance that you will develop diabetes. So what we will do? Avoid carbohydrate from now. And if you, I assure you, if you take care now, you will never develop the diabetes. Or if somebody has family history of cardiovascular disease, stop eating fat. Because usually it starts with the atherosclerosis. Should do daily exercises, even for diabetic family. I will ask them to go for daily exercise. At least walk for at least 2 kilometers daily. Inshallah, nothing will happen, right? Exactly like that. Asthma, yes, asthma. Then you have to avoid the allergic things that cause asthma, so you can control yourself. Smoking incidents, lung cancer, as we were discussing. So there were a few people who had a genetically, factor which can cause this thing. So example of interplay between genetics and environment, as I said, the people do not have gene for CCR5. Some people, most of them they have. So they don't allow HIV virus to come in. So they don't develop HIV. But how many? Less than 0.01%. It doesn't mean that you have to be or people smoker, they never develop cancer. Why? Because they have a genetic variation in which they encode enzyme that metabolize xenobiotics. Xenobiotics are the bad things. Like in cigarette, we have nicotine. So nicotine had to be metabolized. So these person who has this gene will easily metabolize the nicotine. The nicotine is gone, but his friend, The person who is having 2 packets of cigarette is offering his friend to have one, no problem. He started 1, then he will take 2, then he will take 5, then he will start keeping pocket a cigarette packet in his pocket, and then he start becoming a big smoker. That person who had this gene is been protected, but the other person who has started is not having that gene, right? So you will develop cancer. I remember one of my good friend. I used to ask him, stop smoking. Nothing will happen. 3 years ago, he died. It's not a big age. And then you always blame, oh Allah. No, it's not Allah. You are doing from the beginning, and you are blaming Almighty. So if you stop all these bad things, inshallah, nothing will happen. Finally, patient exposed to penicillin have a serious adverse effect. Those are hypersensitivity patient. Normally, if you give penicillin to anybody, nothing will happen. But there are some people, if you just start giving penicillin, there is anaphylactic shock. People may die. So there is all, environmental and genetic factors. Nomenclature of the disease. Only few things regarding this. In 1918, the representative of USA, the possibility and desirability of creating standard medical nomenclature. For example, if I'm sitting here in Saudi Arabia, the other person is in Japan, the third person is in Germany, the fourth person is in America. At least we should know a common name of that disease. So what they did in 1918, that they make a full book, and they have classified the disease in that book, and they have circulated that book throughout the world. That for example, if I'm in Saudi Arabia and suddenly I have a lot of money, I can go to America for my treatment. So they should know that from which disease I'm suffering from. Or if the person is in Japan, he should know. For example, infection of Salmonella typhi will cause typhoid. Everybody should know that Salmonella typhi will cause typhoid. So they have specifically notified this in a bit. This is all about this nomenclature. This is what we have discussed here. Now they have actually put this book, and by discussing together with the Royal College of Physicians of London and Bellevue Allied Hospital, New York, they made a complete book, and they have specified and classified the disease and circulated that book throughout the world. Now everybody knows this disease is this one, this disease is this one. So this is all nomenclature of it. Some important things we should know, which comes in our daily life: morbidity and mortality. So morbidity is, it's a sum of effects of the disease. For example, this disease is called cough and fever, upper respiratory tract infection, viruses, right? Influenza virus. What it does? Cough and fever. But if it becomes more strong and involves the lungs, cause pneumonia, now probably we will discuss about how much chances are there the patient can die. That is morbidity. Oh, sorry, mortality. Mortality is evaluation of percentage of death. This is percentage of death to this patient. This is mortality rate. This is morbidity, means disease is causing this thing. For example, we were discussing about acute appendicitis. What is the morbidity? The patient will be having severe pain in the right iliac fossa. This is the main sign. Plus, the patient will be bending his leg up. Plus, he might be having a fever, right? So these are symptoms, which is morbidity. And for example, if you don't take the patient in emergency, and it took you 2 to 3 days, you are living in a village in a backward areas, and the patient, when he comes to the hospital, the appendix ruptures, then we will think of, normally the patient never die of.
Does the morbidity have anything to do with the severity of the symptoms?
Definitely, we will discuss everything. You are talking about morbidity.
Yeah.
Morbidity, we will discuss that this pain, for example, in heart attack, it's excruciating pain. That's the morbidity. And the patient die of that heart attack. That is mortality. So if you have chance to take that person within few hours, or even in heart attack, if you take the person within 20 minutes to the hospital and give you some medicine, which is streptokinase, you can even save that patient. Even the heart muscle will be saved if you reperfuse in emergency, right? Okay, then acute and chronic. There are diseases which will be rapid onset, which is called acute. This is we will discussing this thing in inflammation when I'll be teaching you acute inflammation, chronic inflammation. Acute within minutes, 2 hours, 1 day, 2 day, maximum 4 5 days, not more than that. Chronic, long time. For example, TB usually develops months to develop. It's not acute. Clear? Then we have some prefix. Hyper, lot, more, excess, hyper, hyperplasia, multiplying cells. Hypo, low, down, less, deficiency. Hypothyroidism, deficiency of thyroid hormone, hypothyroidism. Hyperthyroidism, excess of thyroid hormone, right? This means disorder, any disorder, genetic disorders. We'll call it this. New means new. New plasia means new growth. New. Meta means change from one epithelial cell to the other type, but it should be mature. Squamous epithelium changing into columnar epithelium changing into squamous epithelium. Do you have any example? Yeah. Huh? GERD. Which cause? Which cause in GERD? What happened? Which epithelium? Stratified squamous into columnar epithelium. Okay. And on the other side, if it is cervix, the columnar epithelium change into squamous one because of yes. Then we have so this is metaplasia. Anaplasia means change of the shape of the cells. You are not able to recognize. Normally, when you see under microscope, you can easily identify squamous epithelium, columnar epithelium. But if in cancer, and it's a poorly differentiated cancer, you are not able to identify. Then we have suffix. For example, itis. We use this itis by inflammation. Gastritis, colitis, appendicitis. So itis word is used for inflammation. Oma, tumor. Benign or malignant? Oma. Yeah. Is seminoma benign? Is lymphoma benign? No. They are malignant, but they have oma. So it means that oma doesn't mean that we are talking about benign. So it could be benign or it could be malignant. Yes, you can say that oma means tumor, majority. But is granuloma tumor? No. Granuloma will teach you in inflammation. That's an inflammatory process. So there are some exceptions. Oocyst. Oocyst is actually a state or a condition. Amyloidosis. Something which is accumulated between the cells. So this is a state or condition. Oid. Oid means looking like, bearing the same resemblance like epithelioid. Basically, it is not epithelial cell, but it is looking like an epithelium. Epithelioid. Macrophages. You know what is macrophages? The histiocyte or the monocyte, once they come out from the blood vessel, usually when it is in the blood vessel, it's called monocyte. As it leaves the blood vessel and come into the tissue, the same monocyte will become macrophage. And when it is activated, it is called epithelioid cells. How it is activated, we will teach you. I will teach you that. Penia, lowering. Leukopenia, lack of leukopenia, less amount of WBCs or whatever. Cytosis, more increase in our leukocytosis, increase in WBC, ectasia, dilatation, duct ectasia, plasia means disordered growth. So if you add new with plasia, it become neoplasia, disordered growth. Opathy. Opathy means abnormal state lacking specific characteristic. Opathy. Nephropathy. So there is lacking of specific. The characteristic of kidney is to produce urine, but in disease process, the kidney is not producing that much urine, right? So neuropathy, disease of the nerves, neuropathy, right? Okay. Then we have classification of the disease. So whenever you get the patient, you first of all have this thing in your mind. Either it's congenital or it is acquired. If it is congenital, is it genetic or non-genetic? And if it is acquired, we have a full list. So this is a chart in which you can differentiate very easily a different types. For example, this congenital, this is genetic, this is non-genetic. Genetic will be either it is inherited. If it is inherited, it is cystic fibrosis. If it is spontaneous, it is Down syndrome. So the Down syndrome people which is born, you must have seen some. Yes, so you must have seen in some families those children who are having a mongoloid face. It's not running in the family. It can have, anybody can have that Down syndrome, baby. So it is not inherited, basically, they are spontaneous one. The non-genetic one, environmental, if a mother has rubella, the baby will develop something. Or accidental during parturition, during a process of delivery, the baby may have some problem. Right? Then we have acquired one, inflammation, acute and chronic. In acute, we have acute appendicitis, chronic is the tuberculosis, growth disorder like neoplasia, we have lung cancer, and we have non-neoplastic one, benign prostatic hyperplasia, which is basically a hyperplasia, but we don't include that thing in neoplasia. Injury or disorders like kinetic force, bone fracture, something has hit, bone is broken down. Chemical one, if you eat aspirin, that will cause effect of your stomach, that is cause problem. Hemodynamic shock, hemorrhagic shock, loss of blood, or you have occlusive lesion like myocardial infarction, the blood vessel is blocked down. Disordered immunity like immune deficiency, the patient will have AIDS, or autoimmune allergy like Graves' disease or thyroiditis, grave thyroiditis. Metabolic, important. In metabolic, you have diabetes, or degenerative, you have osteoarthritis. Okay, so please kindly remember this. The question can be asked from this chart. We can put one or two with the other diseases and we'll ask which type of disease. Then some characteristic of the disease. We have to know about the definition of the disease. For example, tumor. So what is tumor? So definition of the tumor, epidemiology means age, gender, class, and geography, which area it is common. Then etiology, cause. Then we have pathogenesis, how it develops. Genetics, which genes are taking part. Morphology, gross and microscopic, both we will see. Clinical features, how that tumor will behave. That is a clinical feature. Then complication, when this tumor has occurred, which type of complication will it produce, and prognosis. May this patient die of this cancer or no? So we will discuss all. So we have basically four important aspects: etiology, pathogenesis, morphology, and clinical. Every pathology, when you see, these are four important things that you had to keep in your mind, right? Cause of the disease, mechanism of development, morphology means gross and microscopic, and clinical features. Now we are doing with the clinical case, and by which we will be able to come into conclusion. 48 years old man presents with a history of blood in his stool. He's lost weight 10 kg in 8 months. His brother had a colon cancer at the age of 35. So you have a hint that his brother had colon cancer. History on examination, middle-aged man with the evidence of weight loss and pale skin. The abdominal examination show irregular liver edges and suggestion of mass in the lower abdomen, mass. So the surgeon has palpated out, the doctor has palpated. Rectal examination show blood, but the mass is not seen, means the mass is somewhere up, not there. So the differential is probably he might have piles because the bleeding is there. He might have inflammatory disease, bowel inflammatory disease, inflammatory bowel disease, or they have diverticular disease, or they have tumor. So how we will approach? Refer to the consultant. So the patient is with general practitioner. So he had examined and now he had a conclusion. He is referring that patient to the surgeon to have better approach. So what the surgeon did, sigmoidoscopy show 20 centimeter mass and he biopsied, right? So this is how he did. This is actually a colonoscopy, a sigmoidoscopy. Colonoscopy, you go through the rectum and go up at 20 centimeter, he saw a mass. And then, while looking, there is a camera, small camera in a colonoscope. So you see a mass. This is a chopper. So you take a chop of the mass and take it out, put it in a bottle, send it to the histopathologist, meaning us. So histological mass, not normal, glandular neoplasia, pleomorphism is there, and you might have vision. So surgeon do excision, means taking out that particular, yes.
What's pleomorphism?
Pleomorphism, we will tell you, Dr. Oban, when he will be teaching you. Pleomorphism basically means abnormal cells. The cell has a specific shape, right? But if the cells become larger in size, the color of the shape become more dark, that is called hyperchromasia, pleomorphism, irregular shape nuclei. Basically, pleomorphism means irregular. Okay, so he did the surgery, confirmed the diagnosis. So this was actually the cells on histopathology. We will discuss later on. So these are abnormal. If you have little idea about the colonic histology, is these cells looking normal glands? No, these glands are closely packed each other, if you remember. And this is called pleomorphism, as somebody was asking. These are large looking big nuclei. These are all pleomorphic nuclei. This is mitotic figures, right? And irregular in shape. So you're dealing with cancer here. Okay, so confirm the diagnosis, more information like size, spread, involvement of the lymph node, lymphatic and vessels. And then central to the definition, future treatment. How will you treat the patient? And then finally make a prescription about like course of the disease, how, prediction of the disease, how it will behave, like prognosis of it. Okay. So this is a mass he has taken out. This is gross picture. And you can see that this big is a mass, right? So the surgeon will not only take the mass out, but he also spares some of the area from here and from here. Why? He had to take little space so the disease should be taken off completely. So he also takes some normal area from here and here. As a pathologist, then we measure that it is 5 centimeters from this area, 4 centimeters from this area, to make it clear that the margins are free. Right? It's very important. If the surgeon would have taken from here, I would say there is no preserved margins. The tumor is reaching up to the resection margin. This is very bad. Means it's a bad surgery. So surgeon had to take some normal thing to take out the whole tumor out. Okay. Then we have a list. Is it congenital acquired? It is. Why? It's not congenital. So what out of these? Is it vascular, infective, traumatic, autoimmune, metabolic, inflammatory? It's a neoplastic. So it's a neoplastic disease. Then we have another chart. Definition. So the definition is it's a neoplastic condition of epithelium. Then etiology, epidemiology. Epidemiology say it's a common thing, increase in the age Oh, it's time. So this is how you go for it. Just 2 minutes, doctor. Then etiology, the cause, how the disease is forming, pathogenesis, how it occurs to the patient. Colonic one, usually inflammatory bowel disease usually take care. Genetic factors, which genes are taking care. The genes are FAP and uh, uh, hereditary non-polyposis colonic cancer. Morphology, how it looks like grossly, how it looks like microscopically. Then clinical features, the pain in the abdomen, and probably there is obstruction. So these are all clinical features. Then complication will be metastasis. The tumor has metastasized to the liver, and finally prognosis, that how much life expectation of this one. So we will do, for example, now if A only confined to the mucosa, submucosa, the prognosis is very good. 5-year survival rate is more than 80%. If it is gone through the muscularis propria in the second one, the life expectancy between 60 to 55 to 60. If the lymph nodes are involved, it goes down to 30%. And if liver metastasis is there, patient never survive for 5 years. He will die within 1 to 2 years, right? So this is how you go. And the book of your pathology is Basic Robbins, 10th edition. And if you have time, you can go for a basis one. Who will look after your attendance? I will do. Okay. Yeah, go ahead.
The common